Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. We have now administered approximately 532,000 doses of vaccine in the province. As I mentioned yesterday, if you're eligible for the vaccine in Phase 2A, there are appointments ready and waiting, so you can get the vaccine within a week. If you haven't booked yet, please do so now. Turning to today's update, over the last 24 hours, we identified 764 new cases of COVID-19 and completed about 14,000 tests. Our positivity rate currently stands at about 5.4%. We have identified 191 additional cases of variants of concern. Variants currently represent about 21% of our active cases. There are now active alerts or outbreaks in 365 schools, which represents 15% of all schools in the province. There are now 294 people in hospital being treated for COVID-19, including 55 in the ICU. 3 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the loved ones of these individuals and anyone who is mourning a death right now. After a year of this pandemic, all of these numbers I have just shared can seem like dry facts. I want to remind all of us that each of these numbers is a person. These are people who have died. These are people who are in hospital or ICU, and people who have tested positive and are navigating the illness as best they can. I know that we are all so tired of this pandemic. It might feel like the actions that we take on any given day don't really matter to those around us. It's easy to forget that our actions have a real-life impact on people we care about, as well as people we may never meet. A year into this, we all know what we need to do to slow the spread of COVID-19. But I know we're also tired of doing these things. It has been a long, hard 13 months for everyone, but we can't give up now. We've made it too far, and we are too close to getting through this. Each of us needs to look at ways that we can help slow or reverse the growth. This means being extra cautious and making the safe choice tonight, tomorrow, and in the weeks ahead. The choices we make now will determine if cases are still growing in the days after Easter. Spring is here, and I ask that all of us use that fact for encouragement to hang on just a few months longer to the actions that we know will protect those around us and our communities. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. You said yesterday that additional restrictions may be necessary if there's escalating growth and a rise in variant cases. What is a tangible threshold that must be crossed for restrictions to be implemented? Is it, for example, if variants become the dominant strain, if daily cases cross 1,000, if there's a certain growth day over day or week after week?
We've talked before about the importance of using multiple indicators to make sure that we're getting the full picture of what the situation is. And we need to be looking at our new case numbers, we need to be looking at our positivity rate, at our RT value or that growth rate of new cases. Obviously, variants are also an additional metric to watch, but there's no single metric that will tell us when we need to implement something or not. We need to be looking at that overall picture and a combination of all of those factors before we're able to make good decisions about what kinds of things may be necessary.
Is there a follow-up, Julia?
Yeah, I recognize you're talking about growth and the change and how there is no one single metric, but how do you explain to Albertans why there are no specifics about what exactly could trigger more restrictions?
Part of the reason it's important to, again, look at that whole picture and not be focused on just one single thing is that each of those metrics tells us a bit of a different story. And so if we only look at one or if we have just one number, essentially what that would do is it wouldn't really give us, again, that complete picture of where the issues are. So we need to be looking at the trends. We need to be looking, for example, if our new cases are stable, but our positivity rate is climbing, it could be because we're not having people going for testing. So again, we can't look at any one thing and point to that as the issue that that would trigger a particular restriction needing to be considered. We do have to look at that whole package and all of those together to get that full picture.
Operator, could you put through the next caller, please?
Next is Matt Woodman with CTV Edmonton. Go ahead, Matt.
Hi, Dr. Hinshaw. You mentioned today that about 21% of the province's active cases are some sort of variant of the virus. At what point will the variants be considered the dominant strain in Alberta?
The tip over to variants becoming the dominant strain will likely happen at a regional level first before it happens at a provincial level. And while I don't have the specific numbers in front of me right now, certainly one of the things that we're watching is those regional trends to see where the cases are, variant cases in particular, are rising more so than in other places. And ultimately, again, the importance of variant cases becoming that dominant strain is really just about the impact that has on growth, the impact that has on hospitalizations and ICU admissions. And so the variant by itself is not, again, the only important metric. It's all of those metrics put together.
Matt, is there a follow-up question?
Yes, there is. I'm curious, why are NHL players coming from the U.S. being given an exemption to quarantine for 7 days instead of the full 14?
There are a set of different groups that are able to follow modified quarantine or who are exempted from quarantine. So there are essential workers who come across the border who are not required to do quarantine. There are individuals who come across the border who are, again, depending on the kinds of protocols that are followed and the kinds of safety precautions that are in place, with additional testing and additional follow-up with the medical personnel overseeing those protocols, and that would be an example of the NHL. That in some of those cases, there is an exemption to allow particular activities. So to be clear, it's not necessarily an exemption from quarantine in general, but certain activities may be permitted, such as going to work at a workplace, or again, in the case of the NHL, it could be going to practices, if those appropriate precautions with oversight are in place.
Operator, could you put through the next caller, please?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. Has AHS intervened in the operations of Joey Eau Claire, which had intended to reopen today but then canceled at the last minute?
I rely on my local colleagues to manage specific local issues, so I don't have details about that particular situation. What I know is that my colleagues at AHS work collaboratively with businesses and operators of different organizations. And so the information that's emerging about any particular location, and again, I don't have the specifics on this particular one, but information would be shared with those operators so that decisions could be made in the best interests of the public. And again, whether or not there were issues in this particular case would be questions for AHS.
Kevin, is there a follow-up question?
Yeah, there sure is. Spring break is coming up pretty soon here. Are you considering moving students to online school for the week after spring break?
The question of virtual learning versus in-person learning has a few different aspects to it. From a health perspective, what we have seen is that when cases are high in the community, when we have high community transmission, that can impact schools with respect to exposures that happen. To date, throughout the course of the last year, we have seen that the precautions that are in place in schools mitigate the chances for the virus to spread. So while there is some transmission, we aren't seeing large outbreaks. So from a health perspective, that's not something at this point in time that we would be requiring. But of course, there are other perspectives that would need to be taken into account. And so Again, the decisions about whether or not students would be learning virtually versus in person would have to be made based on all of those different factors. But from a health perspective at this point, again, schools themselves aren't seen to be a significant issue. But what we all need to do is minimize community transmission to keep schools and other settings safe.
Operator, could you put through the next caller, please?
Next is Lauren Boothby with the Edmonton Journal. Go ahead, Lauren.
Hi, Dr. Hinshaw. I spoke to a researcher yesterday who did some statistical modeling based on your data showing that we could basically reach the same number of cases we saw at the peak of the second wave by mid-April if we don't bring in any restrictions. So what does your modeling show about where we're headed in terms of variant numbers? And to re-ask Julia's question differently, is there an amount of variant cases we might need to see, or percentage of variants, given that they reproduce faster and are more deadly, that Albertans could look for as a signal that more restrictions are coming?
With respect to modeling, it's important to remember that models are never a crystal ball that tells us exactly what the future holds. Models are thought experiments that tell us, if a certain set of assumptions are met, what some possible outcomes could be. And so we certainly know, even without looking at models, we know by looking at European countries, for example, where B117 has become dominant, and where public health measures aren't necessarily being followed in a regular way, that it can spread very quickly, and it can have impacts not just from the number of cases, but also impacts on hospitals, impacts on the number of deaths. And so, again, what really determines the future isn't models. What determines the future is our collective actions and our collective determination to protect our communities by following the measures that are in place right now. With respect to the variant and whether or not a particular number is the specific threshold, it's really important that, again, we're not looking at any one solo thing by itself, but that we're looking at all of those factors. We're looking at the variance, we're looking at the overall case growth, positivity, our value, as we're making decisions about whether or not and at what point additional measures may be required. But I will reiterate that the future is really up to us, and it depends entirely on the behaviors that and the actions that all of us take every day.
Lauren, is there a follow-up question?
Yes. So I've asked this question privately many times and publicly a couple times now, but we still haven't gotten an answer. So what venues are we seeing the highest COVID cases and outbreaks, say, like, 20% of cases linked to restaurants or gyms or something? I think the public deserves to know which activities they think might be safe, but because they're open, but maybe they're not. So where are these cases happening? What activities are risky for things that are open right now?
The number one riskiest activity is living in a household with someone who's infectious, and we see 40% of our cases spread at home. And while people may think that that is an inevitable statistic, I would remind all of us again that while home is the place where we feel we can let our guard down, if somebody in a household starts to feel symptomatic, if somebody in a household has been exposed to a case of COVID-19, there are things that we can do in our households to prevent the spread within that group. And so if someone is symptomatic, having them stay away from other members of the household, getting tested right away. If someone is a close contact, I would again encourage people to make sure that that individual is staying away from other members of the family. If that's not possible to do, there are isolation hotels that are available free of charge to support people to quarantine or isolate outside of that family home, because almost half of all of our new cases come from people's households. And so, again, I think the critical piece is we're looking at the other activities outside of the household. There is no other activity that even comes close to that proportion of our new cases. But what we are seeing is no matter what setting people are in, whether they're in, as you said, a restaurant, a fitness facility, a workplace, whether they're having a social gathering that is right now against the rules, where they're letting their guard down, they're not following the public health measures, we're seeing spread across multiple settings, and that is the biggest problem that we collectively have the power in our hands to change.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Next is Colleen Underwood, CBC. Go ahead, Colleen.
Hi, Dr. Deena Hinshaw. I just wanted to ask about the outbreak at Cargill. We noticed that in early February, the number of active cases was at about 11, and I think the latest numbers we have are that they're up to 75. So do you know if there's a lot of work being done to curb that caseload, given its history?
Again, the information I have comes from my colleagues at the local level who are working on this particular outbreak, the same as they do for any outbreak across the province. And the same kinds of interventions are being put in place with respect to, again, ensuring that all the appropriate measures are in place at the worksite, ensuring that workers have all the supports that they need in all locations, whether on or off the worksite, to be able to safely isolate, to safely quarantine, wanting to make sure that people don't have to choose between, again, a regular income and following COVID rules, so ensuring income continuity and that people have access to income supports. All of the things that we have seen time and time again are critical to successfully intervening in an outbreak are being put in place, and there are local teams that are working on that.
Is there a follow-up, Colleen?
Just go back to the spring break question. I was curious, so after Christmas holidays, you kept kids home for an extra week, but you're saying this time you wouldn't have to. I guess I'm just trying to get clarification about what the difference would have been.
Sure. In November, December, as you may recall, we had our peak of active cases in December with just shy of 2,000 new cases in a given day, as well as in late December was our peak of hospitalizations with just shy of 1,000 people in hospital receiving treatment for COVID-19. While our case numbers certainly are concerning at the current time, we're not seeing again that same extremely high peak, and we are encouraging people to not travel over spring break, to not gather with people outside their household, and the impact again of people's decisions is going to be that's going to determine whether or not we need to consider new restrictions in the future. So the choice of whether or not to keep kids home for that week, again, is about a few things. First of all, we are seeing lower cases, lower hospitalizations at this time than we saw at Christmas. And second of all, again, we're not seeing that same significant school impact that we had just before the Christmas break with respect to the total number of students and teachers who we had out on quarantine or isolation. And so again, what I would say is the choices that we make now and in the coming weeks, that is the only thing that will determine our future, and making sure that we're following the public health measures every day. That's what's going to make the difference, not necessarily whether or not we keep kids home for the week after spring break.
Operator, could you put through our second last caller, please?
Emily Mertz with Global News. Go ahead, Emily.
Thanks for taking my question. Dr. Hinshaw, I'm wondering how having multiple variants of concern circulating is impacting hospital capacity. I understand the preference is to keep patients in private rooms until a test confirms if they have a variant, and not to mix or cohort wild-type COVID patients with variant COVID patients. But I imagine this takes up more space and more rooms in hospitals. So is overall bed capacity less because of the variant?
That question would be a good one to ask Alberta Health Services. I don't have the most recent information with respect to where they're sitting with bed capacity, but you are correct that the current practice is to not have people with different strains of the virus in the same room. If one person has previously dominant COVID strain and another has one of the variants of concern, we again don't want to take the chance of someone becoming infected with a variant of concern when they have had that other strain. And so the specific impact of that particular approach, you'd have to ask Alberta Health Services for where they're sitting and how that is impacting their capacity.
Emily, is there a follow-up question?
Yes, thanks so much. I know you've been asked this before, but I just wanted to ask if you'd be able to provide some more reasoning behind prioritizing police and paramedics for vaccine, but not firefighters.
Absolutely. I think a common misconception is that part of the criteria that we used, I think some people are under the impression that we used the risk of people being exposed to COVID-19 as a part of our categorization. Or some people, I think, perhaps feel that we've looked at so-called essential services and used the relative value of different occupations to prioritize. Neither of those is correct. The criteria that we used were, first of all, those who were at highest risk of severe illness and death, and those who were the most likely to potentially expose those individuals based on their occupation and the groups that they interact with. So with respect to paramedics, we know that paramedics are often involved in interfacility transfers between long-term care facilities and hospital, and we know that long-term care, supportive living facilities are some of those highest risk environments. And so that was part of that consideration that went into ensuring that those very high-risk settings had some of that wraparound protection by protecting individuals who are going into those environments. When we chose our phase 2 sequencing, one of the things that we were looking at were the settings that are at very high risk of explosive outbreaks. So going from one person who's infectious to many who could be spreading the disease very quickly. And the settings of correctional facilities and shelters for those experiencing homelessness were two of those settings. And we know that frontline police officers are often interacting with those individuals on a regular basis in person. And so again, part of that wraparound of the individuals who work with those particular settings was to include them in that sequencing. And I want to make sure that it's very clear that people who work in occupations where they are personally potentially exposed because they're working out in public, we recognize that that is an issue, and I would love to be able to give vaccine to every Albertan and to all those who serve in those frontline ways, because it provides an incredibly valuable service to our community. The reality is that we have a very short supply of vaccine, and we have focused it on those at personal high risk of severe outcomes, and again at those very high risk settings of extremely large outbreaks and those who work in those settings.
Operator, could you put through our final caller, please?
Final caller is Bill Kaufman with Post Media. Go ahead, Bill.
Hi, Dr. Hinshaw. I understand that BC has announced tougher penalties for non-compliance of public health restrictions. Do you think that's something we should consider here if our numbers keep going up?
I haven't seen the BC framework, so wouldn't be able to comment on that specifically. I don't know how it compares to our current framework that we have in place. I think it's really important to remember that while there have been some high-profile examples of individuals or organizations not following the public health measures, the vast majority of Albertans continue to put their communities first, put their neighbours first, and make the choices that keep all of us safe. And as we're looking at the ways to ensure that Albertans who are feeling tired of the rules and maybe inclined to leave them aside, what are the best ways to encourage them to continue making the right choice? I think we'll have to look at a multitude of options to determine what would be most successful in bringing the most people along with us to protect our communities together.
Bill, is there a follow-up question?
Yes. I'm wondering, Dr. Hinshaw, are you concerned that there might be enforcement fatigue setting in?
Can you clarify what you mean by enforcement fatigue?
Well, just, officials that are tasked with enforcing these restrictions, they're just maybe easing off.
It's difficult, again, for me to comment on whether or not that's taking place. What I know for sure is that all of us living through this last year are fatigued. We're all tired of COVID-19. And so, again, how that may be playing out within different enforcement groups, I'm not sure. But again, the reality is that COVID-19 is with us, it's growing, and the only way to bring those numbers down is to have more of us following those public health restrictions. And certainly there's opportunities to work together with enforcement colleagues. I'm always happy to have feedback if some of those things are being observed on the front lines. But what I would say is that individuals who are working in enforcement roles have been serving their communities faithfully for over a year. And so I would ask all Albertans, if they're in an interaction with somebody whose job it is to enforce the public health rules, please remember that they're doing that to protect you, to protect those around you, to protect your communities. And I would ask that anyone in those interactions remember that those particular officials at the front line who are doing that enforcement activity are doing it for their community's benefit, and they need to be treated with respect, just like all of us would want to be treated with respect, no matter the situation.
Thank you all for joining us. Dr. Hinshaw will provide another update on Tuesday afternoon. Have a great night.